All right, this is Christian. He's a patient of mine. So I started with him about 4 weeks ago, and he had this debilitating pain across his back that he's had for 20 years. And he said the last 3 years, it got significantly worse, and he said that nobody really understood how bad this pain was. He went to orthopedics and chiropractors, and nobody could really diagnose what was happening here. And the reason why is because it didn't show up on an X-ray and MRI. So essentially, what happened to him is he had the sacroiliac joints that were locked like this. They were jammed, and that causes severe pain across your back. And in some cases, it can actually cause what looks like sciatica, but it's actually not true sciatica. And it did not happen with him, but most of my patients actually have this sciatic-like symptoms. So Christian is 4 weeks into this, and he mentioned to me today that the pain's generally gone. He just has a little bit of soreness, which is how it kind of dissipates and goes away as we work through this process. Now he can extend all the way back. Go extend back. He can extend back where when I met him, he couldn't extend at all. And he actually had a very interesting symptom in terms of this condition. I saw this in a girl years ago, a 13-year-old girl that had went to every ologist that you can imagine for the fact that she couldn't sit up. And cardiologists, they didn't know what to do about it. They were going to do experimental muscle lengthening surgeries on her, and they eventually referred her to a psychiatrist and said that it was in her head. And Christian just mentioned to me today that he screamed the other day in his house because he could actually sit up when he couldn't sit up before. So Christian, would you mind showing what before you couldn't do, which is what? So when he laid like this, he said he literally couldn't go. He had to turn over and sit up like that because he couldn't. You couldn't like get up like sit up and like that. You couldn't do that, right? And the reason why is because his back was like that. So he couldn't actually sit up. It's kind of a rare presentation of it, but he had to roll over and do that. But you just saw him for the first time, and you said a long time, right?
Years.
In years, be able to sit up in what's called long sitting, just like that, because his SI joints are starting to open, and the back pain is starting to dissipate. So his SI joints are opening, and the back pain is starting to dissipate, and he can actually sit up now. So he's probably another two weeks away from being totally good, and then I showed him what to do if it ever comes back.